All right, here we go, everybody. So, I'm Dr. Zach, like I said before, from Gonstead Family Chiropractic out here in sunny San Diego, California. And, one second here, let me just do something. All right, we're good. Concussions. The truth be told, again, sorry, there is some technical difficulty here, and let me fix that. There we go. All right, now we're ready to roll. So, Dr. Zach, San Diego, California, Gonstead Family Chiropractic. Tonight is on concussions. The truth is going to be told tonight. A lot of fun facts, a lot of fun things going to be happening. So, right off the top, I'm just going to give you a quick rundown of who I am, why this is so passionate for me to do. So here we go. I've had 5 documented concussions. I've seen world-renowned specialists. I speak on behalf of the Mary Sayal CTE Foundation, started by Junior Sayal's sister out here in Oceanside / San Diego. I've been and currently am the team doctor for several sports teams, high school, professional, you name it. I've done it or working towards doing it. I've played several sports in my life, played 2 collegiate sports, so concussions were a part of my life, very, very big part of my life, actually. So that's just a quick rundown. Now let's get ready to roll, buckle in. I got some really fun things to share with you, and I think some things that you are going to be very caught off guard by, and you're definitely not going to want to miss it. So here we go. All right, concussions. The Mayo Clinic. This is definitionally what the Mayo Clinic says is a concussion. It's a traumatic brain injury that affects your brain function. Pretty straightforward, but what a lot of people don't know is some of these symptoms. So, think and remember, everybody knows it's difficulty to think clearly, you have a foggy mind, difficulty concentrating, headaches, vomiting, dizziness, fuzzy memory, sensitivity to light. The big one here, irritability, nervousness. That was a big one that my parents caught on me after a pretty significant concussion. The other thing is sleep. That's a really tough one to really get a read on people. Sleeping more or less than usual, trouble falling asleep. But the big ones, irritability, headaches, nausea, dizziness, and just a foggy mind. Okay? So close to 2 million U.S. children and teens suffer from concussions annually. So what is that saying? Well, there's approximately, you're talking about 3% of the population. 2 million is 3% of the population of children and teens in the U.S. So approximately half of those kids are going to play sports. You're talking about 6.5%. Okay? But more importantly, when you break it down into the numbers, that's 1 in 20. So imagine you're sitting in a classroom, or your child is sitting in the classroom with 20 kids. One of those kids is going to have a concussion that year, statistically speaking. Concussions also contribute to approximately 30% of all brain injury deaths. Okay? Of all injury deaths. But have you ever been that kid in that classroom, that 1 in 20? I know I have. I know it's not fun. So, why are people, again, 30 million. So there's approximately 70 million people, children, student athletes in the football, basketball, you name it. That's based on the 1997 study. Now we jump up to that diagram. 2008 to 2013, so a 5-year period where 2.6 million kids have dropped off of sports. I know growing up, sports were kind of a huge part of my life. Many of you, I assume they're the same. But there's 2.6 million people that aren't experiencing that athletic sports arena anymore. Okay? So let's just jump into it. I know everyone's waiting to hear NFL, football, all this kind of stuff. There's definitely a huge concussion issue within the NFL. There's no denying it. It's under a huge microscope. The NFL, the football, all of that is a very violent sport. It's a lot of high speed, high energy collisions, and they're happening on every single play. There's no downtime of taking a big hit. The NFL is saying that they expect 1/3 of their players to develop long-term cognitive issues. 4 times more likely to develop Alzheimer's and ALS or Lou Gehrig's disease. And NFL players, median age of death, 57. That is some staggering statistics. Most people are living 70, 80, 90 years old. I have a couple 100-year-old patients in here. So 57, you're talking about half of some of those people. So last thing here, I want to get this out of the way. I am not bashing football. I love football. If I have kids, God willing, they'll be playing football. But football is definitely a huge part. It's under the huge microscope. $1 billion settlement of concussions. It just came out this year. I know the one above it in the picture says average compensation 190, total compensation $5 million. That's not an accurate statement. The $1 billion settlement is more accurate as it just came out. But football is not even close to the most brain-injured sport. So here we go. Let's just take a moment, have everybody just kind of dial in on this chart. Take a look, playground, skiing, snowboarding, ice hockey, soccer, baseball, football, basketball, cycling. What jumps out to you? Because I know it jumps out to me. Then we just look over. I listed them out from highest to lowest. Cycling is 85,000. Football's 46. You're talking about just under half as many. Now you go to baseball, softball, and those are just right below football. So I'm feeling like maybe I should just mic drop this webinar right now, jump off, go play in the rain. But, I mean, come on. You're talking cycling. Who would have thought that one? Here's a big thing. Boys versus girls. A lot of people do not even consider this. They think of the boys being rough, tough, dirty, can handle the hits, can handle the pain. Well, Journal of Athletic Training says the girls sustain 68% concussions compared to boys. Another study, females in high school athletics, specifically high school basketball, are 3 times more likely to have a concussion than your son or your grandson. So let's just play. Let's play the game of stereotypes. Boys, they're mean, they're rough, they're dirty, they take the pain, they handle it, they rub some dirt on it, and they go back out. Stereotypically, girls, they play Barbies. Maybe they're ultra athletic. They don't fit that typical mold that everyone talks about. It doesn't really matter. At the end of the day, that's still daddy's little girl. Whether she's 2, 42, anywhere in between it, doesn't matter. That's just the way it is. And I say this knowing that my own sister can flat out kick my butt, but she's still daddy's little girl. So where am I going with this? Well, your daughter, granddaughter, maybe it was you at one point in that classroom of 1 in 20. So if you have 20 people, your daughter's one of those 20. Imagine trying to learn while being concussed. It's not fun. It's very, very frustrating for the student. This isn't a scare tactic. This is just the facts. This is the way it is. Okay. So the brain, kind of just going back to the image of the brain here. What does it do? What does the brain do? What's its function? Things like that. Dr. Roger Sperry, Nobel Prize winner, spoke about it. Up to 90% of the energy output of the brain is used in relating the physical body to its gravitational field. All right. So what is that exactly saying? What's gravitational field? What does all that mean? Well, you see these rocks. These are in balance, right? Well, your body's in the same thing. When you're sitting, your posture, closing your eyes, staying still, closing your eyes, touching your hand to your nose. These are all things that you know where you're at in space. You can align yourself properly. Your gravitational field pulls you down, your weight bearing, things like that. Your brain's 90% active on that alone. Okay? So that brain, those nerve impulses have to go somewhere. They have to go somewhere fast. Well, obviously you see this nice, beautiful Ferrari that we all would like to own and take for a test drive. Well, your nerves are just as fast. They travel 170 miles an hour. Maybe this car goes 200. It doesn't, you get the picture. But how fast does 170 miles an hour look across a 3-foot distance? The distance from your head to your fingers. A blink of the eye and you'll miss it, right? You're talking 170 miles an hour over 3 feet. Now take that car going in the opposite direction, because just as much signal goes from the brain to the brain. Okay? So everything that's going out is also coming right back in. And we're going to get into that right here, right now. It's called proprioception. There's all kinds of checks and balances within your body. Think of a thermostat in your car. You set it at 68. The car tells it when to blow cold air. It tells it when to blow hot air to keep it right there at that nice, comfortable 68 degrees. When you're stretching out your hamstrings. You get to the point where it feels super, super tight and a little bit painful, right? Well, that's your body telling yourself, okay, that's enough. Back it off. Let's knock it off here. Well, think about back to that other photo with the 90% function and the balance with the rocks, right? Well, that's proprioception. It's keeping yourself in line. It's checks and balances, so you're not wavering, right? Your eyes sends visual back to your mind. Your organs back to your mind. Blood pressure tells it when to pump faster or slower to keep it regulated. As we just talked about, the stretch receptors when you're stretching out your hamstrings. These are all things that go into play. Now look over to the chart over here, right here, and what do we see? Ligamentous injury, proprioception deficits, decreased neuromuscular control, functional instability, repetitive injury. What are we seeing a theme here? Unstable, deficits, neuro, proprioception, and injuries. All this is kind of tying into one thing here. Obviously, everyone sees Derrick Rose laying down. How many times have we seen him come up, lay down from an ACL? Time and time again, his career has been plagued by ACL and knee injuries. A 2013 study, shows that you're 3.79 times more likely to injure a muscle or ligament within 90 days of a concussion. Within 90 days, that's 3 months within 3 months of your concussion, you're almost 4 times more likely to rupture, tear, strain, pull, muscle, or ligament. A 2016 study was performed in Madison, Wisconsin. 2.48 more likely to suffer lower body injury within 90-day period. Why is that? What's going on, right? Well, you have that Ferrari going 170 miles an hour. Your nerves are firing full blast, 170 miles an hour, and you get whacked in the head. You take a big hit. You get ran over, whatever the case is. Now that 170 mile an hour speed is dropped. You're slower. Your reaction time's slower. Things like that are going on. Well, let's take it at 25 to 50% reduction, just to throw out some numbers. We're talking 85 to 127 mile an hour is now what your top speed is. So when you go to run down the field and you go to plant and make a cut to the left, to the right, your muscles are engaging in a certain firing pattern to keep your knees and your other joints stable while you make that movement. They have to fire on cue. If they're slowed down and they're not firing on cue, what do you think is going to happen? Well, Derrick Rose found that out. ACLs. There's so many non-contact ACLs going on right now. It's unbelievable. Do you think it started just in the last year or two that they just started happening, or is it more concussions are happening, or more concussions are documented, now more ACLs are being seen? That's up for you to decide, but I mean, the proof's kind of in the pudding on this one. So, a study was performed on reaction time. We were just talking about the deficits, right? There was a group that was just left alone and to rest. They showed an 8% reaction time increase. Chiropractic adjustments showed a 14, almost 15% reaction time increase. So again, you can see the age group. Obviously, the younger we are, our reaction time's a little different than when we're older, right? Well, nonetheless, look at the normal versus subluxation. Now, this is chiropractic. I'm a chiropractor, so I'm going to talk about it. Excuse me. Subluxations in chiropractic go hand in hand. That's what we deal with on a daily basis. What a lot of people don't know is that we are affecting the nervous system. So that 170 mile an hour is affected. That is your nervous system. When it slows down, the firing pattern slows down. It misfires. Your muscles and ligaments fail to engage to stabilize. So through chiropractic adjustments, we are improving your nerve supply to a lot of these things. Sorry, my dog is trying to attack me. He came to the office with me today. So your spine is the master switch. Your brain's the master switch. Your spine is our key to that. So when we have that 85 to 127 mile an hour car working at 25, 50% efficiency, we want it to get up to 170 to 200 again. Chiropractic is like taking that water hose and unkinking it and allowing that full flow, that full burst of 170 mile an hour speed. Okay? So how do we diagnose these things? What's going on? Well, that's a great question. There's all kinds of protocols. There's NCAA, there's NFL, there's international, there's Olympic. There's all kinds of different protocols that people are using. We're going to kind of talk more so on the NFL because that's the biggest microscope. That's the one that everyone's talking about the most right now. But in general, Standardized Concussion Assessment Tool 3, SCAT 3, which should be compared to the baseline. So at the beginning of the season, you want a baseline, you want that test ran. You want it tested at any point during a concussion. As soon as you suspect one, you should run the same test and compare the two. Impact is a test that I was more familiar with growing up. That's the one we used. But, there's all kinds out there, I'm sure. But SCAT 3 seems to be the number one gold standard way to do this. And here is an image about this. What it is just questions to ask the patient, the concussed, the player to evaluate. And there's a scorecard, and there's an on-field version versus a more in-depth version. Okay? Now, imaging. Everyone loves pictures. Pictures are 1,000 words. In this case, you can take as many pictures as you would like. You can do the CT, you can do the MRI, you can do an X-ray for whatever reason you want, but it's not going to tell you that they have a concussion. It's just not going to happen. The only reason that the imaging is going to be efficient is if you suspect something beyond a concussion, as far as lesions. If you see symptoms getting worse, let's take an image. If you see neurological deficits, let's take an image. Or let's say a bleed of the brain. Let's take an image. Those are great times to do that. But just a concussion is not going to show anything on these images. Okay? NFL Concussion Protocol, like I said, this is what we're going to get into. This has been tweaked multiple times over the years. It was just tweaked about 20 days to a month ago when Tom Savage from the Houston Texans went down with concussion, quote unquote, and it got all disconfigured. Well, that's why there's changes. They're tweaking it to make it better. So I'm just going to read through these. I know you can read them yourself. I'll just go through them quickly. Number one, when you think someone's concussed, get them out off the field ASAP. Obviously, if they're unstable, take your time, put them on the cart, things like that, put them on the board, all that kind of stuff. But get them off the field and get them to where you can assess them safely. In the NFL, they use team physicians and also an unaffiliated consultant. They take a look at the play. They review the focused exam on that patient. If you, beyond a doubt, think that there's a concussion beyond just the review of play and the exam, it's time to take them into the locker room for a full-on assessment. They're going to do the SCAT-3. They're going to do a full neuro exam. They're going to find out what's going on. If that player is concussed, they are not to return to the game that day. If they aren't concussed, they're still going to be monitored throughout the entire rest of the game. It doesn't just shut off just because, oh, you're not concussed, go out and play, and you're good to go. Well, no, concussions can fester themselves. They don't always have to be right away. Okay? I speak from personal experience on that, unfortunately. Recovery time. Recovery is probably one of the most crucial parts of this whole thing, minus your diagnosis, right? If you can't diagnose it, you can't recover from anything. So, majority of people are going to resolve within 7 to 10 days. Children will take longer. If you go back out too soon, you are setting yourself up for an epic failure. You're talking about compound concussion, increased chances of unconsciousness. The list goes on. You are setting yourself up. The length of recovery is going to be substantially longer. So how are we going to manage these? The keystone component of how to manage concussions is rest. You have to rest before anything else takes place. That means no TV, no studying, no reading, no video games. Doctors should be writing notes to your teachers so they know that you are basically sitting there not really sure what's going on. You're trying, but it's not really retaining. Physical rest, no weightlifting, no exercise. Obviously, you see the little girl down here, no TV, right? So I'm going to show you a little bit step by step right here on the next slide. So it's called a graduated protocol chart. There's 6 steps. Each step is 24 hours. Okay, so you're talking about 6 days. Ideally, I personally like the no activity step 1 for 48, depending on how severe that concussion is. All right, no activity, light aerobic, so on and so forth. So they have to go through each step 24 hours, and then they get bumped up to step 2, step 3, step 4, so on and so forth. But let's say it's step 3 during the ice hockey drills or the soccer or the football or the basketball or whatever, they become lightheaded and dizzy and nauseous and all that stuff, the headaches, the blurred vision. Guess what? They go back to step 2 for another 24 hours. So that 6-7 days now just became 8. And that's the way it should be. So that's the way that kind of happens. Some things that I recommend for some of the concussions that come in the office, obviously we adjust them first, foremost, check them out, make sure they're healthy, make sure there's nothing else neurologically going on before we adjust them. Once we adjust them, we also recommend some supplements. These supplements are from Standard Process. That's the one we use in our office. It's not the one you have to use. The reason I like them, they're whole food, things like that. I know where they're coming from. So RNA, neurotrophin, PMG, Cataplex G, tune omega-3, calcium lactate. So I'm just going to kind of go through a couple of these and just let you know what they're for. So the neurotrophin, it's DNA of a nerve, and it helps to prevent autoimmune attack. So when you have things going on in your body wants to attack itself because it's not normal, right? Well, this helps give the nerves some relaxation because the PMG is basically a disguise to help the body know that it's okay, this is that, so on and so forth. Cataplex G, it's nerve relaxation and vasodilation. So it gets the blood moving to where it needs to, but it also lets those nerves relax. Tuna omega-3 is a decrease, So 2 omega-3 is your fish oil. What it does is it decreases inflammation throughout your body, but it also helps brain and heart function. Obviously, in this case, we're focused on the brain health. The next one is calcium lactate. I could have put Mintran in there. They're organically bound minerals. They help calm down sympathetic dominance. So what is sympathetic dominance? Think about the old Toyotas a few years ago where they had millions of them getting recalled. Their gas pedals were getting stuck. There was no brake being applied. Well, that's what sympathetic. Your body has 2 nervous systems, the brake and the gas. You're full throttle all the way. We need to hit the brake. We need to slow you down. And next is some additional information just to let you know if you have questions. Always feel free to email me at drzach@Gonstead Chiropractic. That's sd.com. I know it's a long email, but it will get to me. General information. Parents, this is a nice little website for you guys to check out. It's not too crazy. It's really easy to understand. If you do have questions, again, shoot me an email. Athletes, coaches, same thing. Coaches, whether you know it or not, you're just as liable as the doctors sometimes. So you need to know this stuff. It's time for question and answer.